Good afternoon, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lauren Slow, Peel's Chief Medical Officer of Health, Nancy Duncan, Deputy Fire Chief for Mississauga Fire and Emergency Services, Sam Rogers, our Director of Enforcement, and this week we also have a very special guest, Trevor McPherson, who is the President and the CEO of the Mississauga Board of Trade, who is here to talk about a new campaign aimed at helping many of our small business owners. Before I give my COVID-19 update, I'd like to talk a little bit about the National Day of Truth and Reconciliation, as well as Orange Shirt Day. Both will be happening tomorrow. Tomorrow will be the first ever National Day for Truth and Reconciliation. And as part of the City of Mississauga's commitment to fully understanding our past and building stronger relationships with Indigenous communities as we move forward, city facilities will be closed tomorrow to allow time for reflection and education. We also know that public commemoration of the painful history and ongoing impacts of residential schools is a vital component of the reconciliation process. So that's why tomorrow we will be honoring this day by displaying all 94 calls to action from the Truth and Reconciliation Commission on the screens at Celebration Square, rotating throughout the day. The screens will also include the calls to action up to the City of Mississauga, which we have undertaken, and will show several short films by Indigenous filmmakers as well. We have painted more moccasin identifier stencils on the upper square in partnership with the Mississaugas of the Credit. Part of the moccasin identifier project was to promote public awareness of significant cultural historic sites and the ancestral presence of First Nations, Métis, and Indigenous communities. Tomorrow evening, our clock tower will be lit orange as a symbol of solidarity with Indigenous communities, and our flags will remain at half-mast to honor the lives of all of those found in unmarked graves at the sites of former residential schools. Throughout the past month, we have asked all City of Mississauga staff to take the time to build their understanding and awareness of the history of residential schools, truth and reconciliation, and the culture of Indigenous peoples, through online workshops, guest speakers, and discussions with their colleagues. And today, I was very proud that all of my councillors wore their orange shirts at council as a symbol of solidarity with residential school survivors and those who sadly never made it home. For so many Canadians, the discovery of the thousands of unmarked graves this past spring and summer brought into full focus the darkest chapter of Canadian history. Many of us learned about the residential school system growing up, but I know that many people, including myself, did not understand the true horror of these institutions. I have and continue to grieve for the thousands of children in unmarked graves who never had a full life and who experienced tremendous pain and suffering and deep sadness. I grieve for the parents whose children never came home. And my thoughts are with the residential school survivors who still live with so much pain today. In Mississauga, we stand in solidarity with all Indigenous people impacted by these tragedies. And the recent discoveries remind us that we still have much more work to do as a country to truly reach reconciliation. That's why tomorrow I'll be spending time rereading parts of the Truth and Reconciliation Commission reports. I read many parts when it first came out, but given the events of the past 6 months, I think it's critical to look at it again through a new lens. I have spoken with many Indigenous leaders, including Chief Laforme of the Mississaugas of the Credit, about reconciliation, and I've been told the same thing, that all non-Indigenous people must educate themselves on the truth of what happened at residential schools and the experience of Indigenous peoples in Canada. Only by first understanding the truth can we truly have a meaningful reconciliation with our Indigenous communities. I encourage all Mississaugans to take the time tomorrow to educate themselves on residential schools, truth and reconciliation, and the experiences of Indigenous peoples in Canada. Please visit Celebration Square tomorrow if you can, or visit mississauga.ca/truth/reconciliation or -reconciliation, where you'll find a handful of educational resources. We must all reflect and remember that Indigenous communities were the first to call this land their home, and that as a country, we must unite to ensure Indigenous communities have the respect and support they need to flourish here in Canada. And now for my COVID update. While we continue to see relatively high case counts province-wide, the good news is that things appear to have stabilized over the last month. Peel Region as a whole is averaging 33 cases per 100,000 this week, and that's down from 37 cases per 100,000 last week. Mississauga is averaging 40 cases per 100,000, and that's actually down from 41 last week. Our hospitals are also stable. That's great news. With 16 COVID hospitalizations at Trillium Health Partners and 3 patients in the ICU. The situation is similar at Brampton's William Osler Hospital with 15 COVID hospitalizations and 6 patients in the ICU. If you had told me 2 months ago that these case counts would be where they are now, I don't think I would have believed it. That's because in July and August, case counts were rapidly rising, and it looked as though this 4th wave was going to completely overwhelm us and become inevitable. But what we've been able to do is limit the impact of the 4th wave. The single biggest reason is why so many residents, so many of you, went out to get vaccinated. In fact, 80% of Peel residents are now doubly vaccinated. This is a huge milestone for everyone in our community, and we should all be very proud. This level of protection will be crucial as we head into the colder months and people begin to congregate indoors. I want to thank everyone who has stepped up to get the vaccine. And I want to again thank Peel Public Health, our hospital partners, healthcare workers, paramedics, firefighters, Peel Police, and the dozens and dozens of volunteers who help vaccinate our residents. But the reality is that we can't get complacent right now. We need to continue following public health protocols and their guidance to ensure that we don't put at risk all the gains that we have made. Please continue wearing your masks when social distancing isn't possible. Please, if you have COVID symptoms, even if you're vaccinated, go and get tested and isolate until you get the test results. And above all else, please get vaccinated if you haven't already received your 1st or 2nd dose. Peel Public Health has made it extremely easy to get vaccinated, with walk-ins available every single day at pop-up and school clinics. The easiest way to find out about hours and locations is by visiting Peel Region's website. Along with the other mayors across the GTHA, I am absolutely committed to trying to reach the province's goal of getting 90% of our eligible population vaccinated. Reaching this goal will significantly help keep case counts low, protect our hospitals and our schools, and help ensure that we don't see any more lockdowns or restrictions that devastated so many businesses, especially the non-essential businesses, over the last year and a half. Along with other mayors, we are exploring the possibility of a region-wide initiative to continue to drive vaccination numbers up. I'm also very thankful that there has been a smooth rollout of Ontario's vaccine certification program that came into effect exactly 1 week ago. I want to thank the businesses for making the necessary adjustments to ensure that they are properly following regulations. And to the residents, thank you for your patience. Our bylaw team has told us that they're continuing to support businesses as they interpret the regulations and have received very few complaints about the rules being broken. Like we've done throughout the pandemic, our policy as the city is to educate and inform first, with tickets being the last resort. And I want to ensure everyone that bylaw will not be doing any regular compliance checks. Instead, bylaw will be responding to complaints that we receive through 311. And that is the key point. If people believe the rules are not being followed, or there's a dispute involving a vaccine certificate, please call 311. Our bylaw officers will respond to every single complaint. I want to thank Peel Regional Police for clarifying their role in supporting the vaccine certification program, saying earlier this week that they would also not be doing compliance checks, but will provide support in situations that require them to maintain peace, safety, or address criminal activity. I really don't expect there to be many issues with the vaccine certificate in Mississauga. That's because I know the majority of businesses and residents support this program, as it ensures safety in settings where distancing and masking isn't always possible. People support this program because the vast majority of our residents are vaccinated. At the City of Mississauga, our own employee vaccination policy came into effect this past Monday, meaning that all employees must show their proof of vaccination unless they have an exemption based on medical or religious grounds. Employees who fail to disclose their vaccination status or are unvaccinated will have to participate in education sessions on the vaccine. And if an employee fails to disclose or remains unvaccinated by November 1st, they will have to undergo regular COVID testing in order to enter the workplace. We brought this policy forward because we are committed to ensuring the City of Mississauga is a safe place for all of our employees, all of our volunteers, and the residents that we serve. And I'm also very proud today that Council showed leadership by passing a motion that will require all councillors and myself to show proof of vaccination by November 1st or undergo regular COVID testing to attend committee meetings in person. This will also ensure Council is in line with our vaccination policy, the policy that applies to all of our employees and volunteers. Mississauga, I am so proud of everyone's efforts in our battle against COVID-19. And for now, we need to stay the course in continuing to exercise caution in everything we do. Please continue masking in settings where social distancing isn't always possible. Please continue to show patience as we adjust to the new vaccine certification program. Please encourage those you know who are not vaccinated to go out and get their shots. Please be safe and be healthy. And now I'd like to invite up Dr. Lowe to the podium to provide his weekly update.
Thank you, Madam Mayor, and good afternoon. Mississauga's cases this week stand at 40.3 per 100,000 with a test positivity of 2.7%. I want to thank you, all residents of Peel and of Mississauga, for making a difference. Your vigilance in maintaining precautions and in getting 2 doses of vaccine, with now 80% of our region vaccinated with 2 doses at 12+, has been the foundation of protection in our community. Please keep doing what you're doing as we work to bring protection to those who have yet to be vaccinated. Whether it's masking and distancing in indoor public spaces and crowds outdoors, keeping gatherings small and outside, getting vaccinated if you haven't yet already, and abiding by the new vaccine certificate program, all of your actions are making a difference. They're making a difference in particular to keeping our children in school. And we know that keeping community transmission down through precautions and vaccination will help to reduce introductions of COVID-19 into schools in the first instance. I encourage you to continue keeping up your efforts to ensure that our community stays open even as the weather gets older and takes away our outdoor spaces. We continue to also monitor the impact of the recently introduced vaccine certificate program. This program is extremely critical to reducing risk in settings where precautions cannot be consistently maintained, particularly for those who have not yet received their 2 doses of vaccine. On this, we have seen outbreaks associated with organized youth sports, particularly indoors, with transmission especially noted among those who are eligible but not yet vaccinated, and with subsequent household transmission sickening others. That's why this week I've written to the Chief Medical Officer of Health, Dr. Kieran Moore, asking him to review the current regulation on where certificates are required and to reverse the current certificate exemption for youth sports under 18, staff, coaches, and officials participating in indoor organized sports. This is particularly important since many of these sports are high intensity with people in close contacts and where mask and distancing cannot be consistently maintained. I'm aware that other jurisdictions in Ontario have moved locally ahead to issue letters of instruction on the matter. However, many of these leagues play across municipal boundaries and tournaments attract teams from other parts of the province. It is my hope that the provincial government will act to reduce confusion and ensure consistency across the province and keep these youth and their families safe as they continue to play their sports. Ultimately, ensuring that we do not face a hospitalization and mortality crisis as being seen in Alberta and Saskatchewan relies on all of us continuing to limit discretionary contacts while getting vaccinated with 2 doses. Vaccination and contact reduction is how we will continue to stay ahead of Delta in this end of the acute phase of the pandemic. The waves will stop and endemicity begins when nearly everyone in the population has been exposed either through vaccination or infection. How fast we get there is ultimately up to us. So please don't delay. Please get your vaccine up to 2 doses. Remain vigilant and continue to follow precautions in the meantime, including proof of entry where required, masking, distancing, and favoring the outdoors. Don't become part of the 4th wave of hospitalizations and mortality. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, as always, Dr. Lowe. With so many non-essential businesses now open for in-person shopping and dining, the gyms as well, it can be easy to forget how hard it was the last year and the last year and a half, actually, and how many of our small business owners that it impacted. The reality is that many small businesses in Mississauga and right across the Peel region were closed longer than anywhere else in North America. And that's why I'm very pleased to bring up Trevor McPherson. Trevor is the president and CEO of the Mississauga Board of Trade, and he's here today to talk about a new Shop Local campaign that MBOT, Mississauga Board of Trade, will be launching this fall. Trevor, the floor is yours.
Good afternoon. And thank you, Mayor, for inviting us at the Mississauga Board of Trade to be represented here at your weekly news conference. First, let me thank the Mayor and members of Council for their unwavering support of the business community during the COVID-19 pandemic. You have been strong advocates and have stepped up in so many ways to help our local businesses. Second, let me acknowledge tomorrow's National Day for Truth and Reconciliation and encourage all businesses in Mississauga to mark this important day in some way. I also want to recognize that I am here with you standing on the treaty lands and traditional territory of the Mississaugas of the Credit First Nation and is now home to many diverse First Nation, Inuit, and Métis peoples. The COVID-19 pandemic has been the most significant health and economic impact that our country has faced in more than 100 years. While some businesses were able to continue their traditional business models, many, many more were forced to close for long periods of time and suffered unfathomable financial impacts through no fault of their own. In some cases, government financial assistance programs have helped these businesses through the worst of it. Some have accelerated plans to go digital, and this will serve them well going forward. But nothing, as we know, beats serving your customers and experiencing the business of your choice in person, right at the place of business. It's time to bring people back to local businesses, which continue to contribute so much to the culture of Mississauga. And I'll just say that it's easy for us, perhaps, to think that businesses are opening up, things are okay, that sort of thing. But for these businesses, it's going to take a good long while to be out of the woods, and they need our support right now. That is why, through the generous support of the Government of Canada and in partnership with the Ontario Chamber of Commerce, I am delighted to announce today that the Mississauga Board of Trade is launching Shop Local Mississauga. It's a promotional campaign that will be conducted over the next 3 months to encourage residents of this great city to support its local businesses. We are grateful to our campaign partners for their enthusiastic support of the initiative. These include Mississauga business improvement areas in Port Credit, Streetsville, Cooksville, Malton, and Clarkson Village, along with Square One, Erin Mills Town Centre, and the Heartland District. We are also, of course, very pleased to have the support of the city through Tourism Mississauga and the Mississauga Economic Development Office. So in short, everyone is enthusiastically encouraged to shop, dine, and enjoy Mississauga local. More information is available at shoplocalmississauga.ca. And as a final word, I'd like to remind businesses with less than 150 employees that your Mississauga Board of Trade continues to distribute rapid antigen tests for screening of your employees. And information on that is available at our website, mbot.com. Thank you.
Thank you, Trevor. So please get out there, Mississauga, and shop, dine, enjoy local. Please support our local businesses, Mississauga. And now with Dr. Lowe, Nancy McDonald-Duncan, Sam Rogers, and Trevor McPherson, we're all happy to take questions from the media.
Mayor Crombie, your first question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Good afternoon, Mayor Crombie. Thank you. You said earlier the city would only be responding to complaints related to the proof of vaccine mandate. But if the proof of vaccination rules are important, kind of stemming the pandemic or holding it as it is, why not enact a more proactive enforcement policy where the city would at least do some random checks to see whether businesses are following the rules?
Sure. I'm going to ask Sam Rogers to come up and talk about his policy and his campaign, and he has done those whirlwind tours in the past, so it may be part of his plan going forward. But of course, you do know that we don't have the resources or the capacity to do anything other than by complaint. We can't be proactive in that way other than the odd weekend blitz. But maybe Sam, maybe you want to enlighten us on whatever program you have coming down to with respect to checking on vaccine certification. Sam, over to you.
Thank you, Mayor Crombie, and hello, Steve. Thanks for the question. So that's correct. In the first week, we've made an operational decision to be complaint-based, and that's really balancing out how we've seen the pandemic and the regulations unfold over the last year and a half. Over the last year and a half, we've done tens, if not hundreds of thousands of inspections, and we know our local businesses very, very well at this point. The proof of vaccination is just the most recent change in regulations, and we're confident that based on the complaint numbers we've seen and our history, that compliance is exceptionally high. With that said, we are in the process of planning, alongside Peel Health and the Ministry of Labour, some proactive education blitzes. But as Mayor Crombie already mentioned, we are in the education and information phase. We are not looking to enforce through tickets and charges at this point, unless it's some type of an egregious offence or there's a long history. So complaint-based for now, call 311. We will be looking at getting out proactively alongside Ministry of Labour and Peel Health in the near future. More details to follow. And we are confident that businesses will continue to comply as they have throughout this pandemic. Thanks for the question.
I have a follow-up for you as well, Sam. I understand there's around 20 complaints received by the city related to the vaccination passports. Can you kind of detail, were any of those what you would call kind of egregious offenses, or were any of them kind of warranted? What can you tell us about what the city so far found?
Yeah. For sure. So in fact, it was 17. I just confirmed those numbers this morning with my team in the first week. With respect to the details, none of them were considered egregious. No charges were laid. This was really a matter of educating and clarifying the rules. And so our approach on that is we're sharing, with establishments what the provincial guidance looks like. We're clarifying any specific questions they have, and then we come back and we'll reinspect at a later date. But nothing egregious that would warrant a charge in the first week. Thanks for the question.
And Steve, don't forget, educate, inform before we enforce. We always give them the benefit of the doubt and educate first. Next question, please.
Your next question comes from Natasha O'Neill at the Pointer. Go ahead, Natasha.
Welcome, Natasha.
Hi.
Hi.
Hi, how are you?
I'm very well. I hope you are as well.
I am. My questions are for Dr. Lowe today.
Sure, I'll invite him to the podium.
Thanks. So, Dr. Lowe, as you noted this morning at Brampton's press conference, we're crawling towards inoculating more and more people, and that's been helpful with the provincial mandates.
Sorry, Natasha.
As a public health authority to help get more people vaccinated.
Sorry, Natasha, you broke up in the middle there, but I'm getting the gist of your question is that you're wondering what we can do just with this significant last mile push. And as I mentioned in my remarks at the press conference at Brampton this morning, we are really moving our resources away from fixed sites to continue the expansion of our mobile and community outreach offerings. We're continuing to work with community agencies, community ambassadors to ensure that we are having clinics in places that are closer, particularly in neighborhoods that have lower uptake, so that people can come out, get their questions answered, hopefully get their shot, and do so in a familiar place with a familiar face. So this is really our current effort when it comes to our mobile and outreach strategies. We're also continuing to communicate. I mean, we're being very transparent in terms of sharing the numbers. Our website, peelregion.ca/COVID-19, has a list of the dozens and dozens of school clinics, the dozens and dozens of community outreach clinics that are underway. This is really it, and the reality is the rate is also some parts on the part of those who are not yet vaccinated as well. They have legitimate questions and concerns which deserve to be answered to make sure that they are reassured that the vaccines are safe, that they are effective, and that they are doing the right thing, both for themselves and for their community. So this is the necessary work that we need to do to ensure that we instill the same confidence in them that they have, that over 1.2 million of our residents, or rather 1.1 million of our residents have already done in taking their 2 doses of vaccine and pushing us back towards normal. Thanks so much for the question.
Follow-up, Natasha? Okay, I believe we lost Natasha. We'll move on to the next question.
No problem. Welcome back. Next question, please.
Your next question is from Declan.
No, Natasha's back. Declan or Natasha?
We'll go to Declan first.
Okay.
Declan from Mississauga, go ahead.
Welcome, Declan.
Oh.
I hear Natasha. Okay. Natasha, I don't hear Declan, so why don't you've got the floor. Go ahead. Okay, one of you jump in.
Okay, hello? Declan. Yep, Declan, go ahead.
Yeah, I think I'm on.
Yes, you are.
How are you, Mayor Crombie?
I'm very well. Thank you so much. I'm relieved things are stable, and that's good news for me.
Excellent. Yes, definitely good news. I'm just wondering, and an earlier question was asked, and you said that you expect a large degree of compliance in terms of the vaccine certificate plan. If 17 complaints quickly escalates, if there becomes some egregious complaints, will more resources be needed in terms of bylaw enforcement? And if so, do you have a plan to handle it in-house, so to speak, or are funds available at other levels of government for that?
The answer is yes to all those questions. Should there be a need, we will certainly reallocate resources. And yes, there is promise of funding from other levels of government. The province is paying many of our COVID-related expenses, and this is one that the mayors, the GTHA mayors, have discussed that we should closely monitor, especially by law enforcement resources. And if there's an increase in use, then perhaps there will be assistance with the funding of those new programs and new individuals. Sam, do you want to talk about? No, he says, but yes and yes, he says as well.
Okay, perfect. Thank you. And a follow-up, please, if I can.
Yes, you may.
And with respect to the rules being enforced at city facilities and so forth, have any situations cropped up, Bonnie, the first week or so of enforcement that have presented some confusion among people or something that's kind of caught the city off guard?
So there has been nothing that I'm aware of, and Sam is just looking at me. I'm going to ask him to think about it. But what I will say is please remember to be kind. These are often young people that are working part-time at our facilities who have been stationed at the door as ambassadors and checking your vaccine certificates. So this isn't their program. This is a program of the provincial government, which we all support, by the way. But these individuals have been asked to check the certificates, and please be patient and please be kind to them. They're often young people. Sam, do you want to comment about anything at our facilities? He's coming up now, Declan.
Hi, thanks for the question. And not much to add from what the mayor already had to say in terms of being kind. Again, it's the first week. To answer your question, though, there have not been any incidents that have come to my attention. Not to say that the rollout doesn't come with some clarification, but there have not been any incidents from an enforcement perspective that have come to my attention. Thanks for the question.
Do we have Natasha back?
Yes, I can actually read Natasha's question as she's having audio issues.
Okay.
It's for Dr. Lowe.
Okay, he's coming to the podium now. He's coming to the podium now. Thanks.
Yeah, go ahead, Daniel.
Dr. Lowe, what is your regional vaccination target? The province has said they want 90%. Do you have a similar target?
Yes, our regional program is part of the overall province of Ontario's immunization campaign, and so our vaccination targets are aligned to what Chief Medical Officer of Health Ciara Moore has indicated, as well as the Ontario Science Table, which indicated in their modelling that anything above 85% 2 doses amongst eligible is really needed to mitigate the worst impacts of the fourth wave. Thanks for the question.
And I just want to concur that I completely agree with the target of 90%. I think, God willing, we may even get higher than that. I know that there are still those individuals who haven't had the opportunity, didn't know how, or have reconsidered their position and want to go out and get vaccinated. We just have to make it very easy for them to do so.
Mayor Crombie, your final question comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Welcome, Khaled.
Mayor, I like your T-shirt. It's orange, and tomorrow is the Reconciliation Day.
Yes,
great.
Thank you.
Yes, that's.
Thank you.
You're welcome. So, today morning there was some accusations and confrontation between TTC and the union representing the TTC workers regarding the vaccination and disclosure of the status of that. First of all, do we have any similar situation here with Midway, and what is the rate of disclosed vaccinated employees and vaccinated employees?
So, Khaled, excellent question. And I believe the union has withdrawn their objection to the vaccination policy. I believe that had occurred later today. So they are now in support, in support of the vaccination policy at the City of Toronto, and I applaud them for doing so. Of course, we have a similar policy in place here. And so we are at the disclosure phase here in Mississauga. So we've asked all our employees to disclose disclose whether they are vaccinated or not to us, and those who are not will have to undergo an education program. And of course, we made that policy binding for all our elected officials and councillors as well today, so I'm very proud of that.
Sure.
But they will have to disclose, and they'll have up to the 31st to do so. Then there will be education sessions, and as of November 1st, if they're still not vaccinated, they will have to present a negative COVID test, I believe, twice a week before coming into the workplace. And that is true of our staff, our employees, our council, our elected officials, and our volunteers, any of those individuals who may sit on some of our committees. So to attend any committee meeting live and in person, you will have to present proof of vaccination. Otherwise, you can join virtually online at home.
Right. This is not a follow-up, but is this vaccination on their expense or you provide the expense?
I believe it's at their expense. You know, this is not clear, Khaled. We can look into this, but they have to present their negative test to the city. So I think it's on their time and on their expense. And if there's a change in that, I will certainly reach out to you and correct the record.
Really appreciate it. And my follow-up for Dr. Lowe.
Absolutely.
And it is, thank you so much.
Here you go.
It is, yeah.
He's coming to the podium. Go ahead. He can hear you.
Very well. It's regarding the announcement today by Dr. Kieran Moore regarding the Moderna vaccine that he will stop using with youth 18 to 24. Dr. Lowe, what is the symptoms of that rare heart disease, and how many we have here in Mississauga, if any?
Yeah, thanks so much for the question, Khaled. I don't have the specifics on the number of cases that have been detected in Mississauga because those numbers are reported at the provincial level overall. Public Health Ontario did a report recently, which you can likely find online with a quick Google search to identify, I believe it was somewhere in the magnitudes of hundreds of cases, but this is on 20 million vaccinations. I think the decision today taken by our provincial partners, as I understand it, was out of an abundance of caution, because it is really, to be clear, this side effect continues to be extremely rare. It continues to be very mild. It continues to resolve spontaneously. But I think that is really just the reason why they have moved in this manner. And we at Peel Public Health are reviewing the direction and will determine how it gets implemented in the course of our vaccine rollout. Yeah, thanks so much for the question. Oh, myocarditis basically usually presents with things like elevated heart rate, chest pain, the shortness of breath. There's a typical symptoms, cardiac sort of symptoms that would be identified, and usually this was actually identified in the course of significant adverse event monitoring. But in terms of the rate, it is still extremely rare, extremely mild, and tends to resolve on its own. So it should not deter anyone because the benefits of getting the vaccine and reducing your risk to a novel coronavirus, which is now really indiscriminate to some degree in terms of age as to who is ending up in ICUs. I mean, you have to look at other jurisdictions. You don't have to look very far, but in other jurisdictions, even younger and younger people are ending up in ICU for weeks and weeks on end. That compared to a mild, spontaneously resolving heart condition that is extremely rare, hundreds out of 20 million doses, I think the cost benefit is fairly clear. Thanks for the question.
Are there any further questions?
That was the last question for the day.
Well, thank you all for joining us today. Have a good day.